Alright, hello everyone. This is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. 9 days, 9 updates, day 2. So as I told you in my previous video that today we'll be covering a chapter of oncology, orthopedic oncology, where I will give you 9 updates to revise this with me. First update. This is a very important X-ray that you can see on your screen, and if you have given any previous attempt of any entrance exam in the country, you will agree with me that this has been coming almost every year for 5 years. So this X-ray shows you a well-defined geographical lytic lesion with air-filled sinusoid. That is what is called as soap bubble appearance. So we are talking about GCT. The classical thing, please understand, growth plate is not visible. That's a very important landmark to differentiate it from my second update, which is this X-ray. You can see a similar kind of a picture, although there are multiple blood-filled lesions, but that's not important. What is important is growth plate is visible. So a similar looking picture, if it comes and you're confused between my first update of the day today, GCT, and my second update of the day today, ABC, then please ensure GCT, no growth plate, patient is skeletally mature, 20 to 40. ABC, there is growth plate, patient is skeletally mature, aged 10 to 18. Coming to the third update. So third update is almost clear to everybody. Almost everybody knows about it. So you can see a periosteal reaction along Sharpie's fiber called as sunburst appearance. You can see periosteal elevation, Codman's triangle. So the third update, I'm sure by now you must have seen osteosarcoma. Most common radiation-induced tumor, most radio-resistant tumor. The fourth update will come in the form of a clinical question. Let me put it out for you. A young boy, 12, 13, maybe even less, pain, swelling, fever, thigh. Thigh is very important. Why? Femur. Pain, swelling, fever in thigh, which is femur. Initial diagnosis looks like osteomyelitis. Reason, blood counts are elevated. TLC, high. ESR, high. Neutrophil, high. CRP, high. And there is fever. So initial diagnosis looks like osteomyelitis, but now you see the X-ray. You can see in the shaft, in the diaphysis of the femur, you can see laminated, layered periosteal reaction called as onion skin, onion peel appearance. My couple of questions. First, what do you think is the diagnosis? You are not aware. I'll tell you why. Because X-ray shows periosteal reaction, which can be seen in both osteomyelitis and Ewing sarcoma. So how can you be so sure of diagnosis? So for this, you have to go for next investigation, MRI. Best investigation, biopsy. And when biopsy shows translocation 1122 along with round cells, along with CD markers positive, which are on the screen right now, then you will call it the fourth update of today, Ewing sarcoma. Very, very important question. After GCT, if I put my chips on, I'll put it on Ewing sarcoma this year. The fifth update, just on this X-ray, you can see a lesion coming out of the bone, out of the femur, out of the distal femur, from metaphysis, growing away from the direction of the joint with a bony stalk, cartilaginous cap. I'm sure all of you are clear, we're dealing with osteochondroma. That's the fifth update. The sixth update is very, very important for all of us. I'll tell you the reason why. Because in this fifth update, again, they will put up a clinical question. Young male, pain in thigh, more in the night time, relieved by taking aspirin. What is the diagnosis? So aspirin is a salicylate. Salicylate is a non-steroidal anti-inflammatory drug whose mechanism of action is basically inhibition of prostaglandin. Do you think there is any tumor which has a lot of prostaglandin inside in a nidus of less than 2 centimeter with a peripheral reactive sclerotic rim? You got it right. Most common true benign bone tumor, that is osteoid osteoma. So coming back, after the first update, GCT, second update, ABC, third update, osteosarcoma, fourth update, Ewing sarcoma, you had the fifth update, osteoid osteoma. Now, you have to understand one more thing here, that all these tumors can come in the form of an image-based question or in the form of a clinical history question. If you will have osteosarcoma, that will usually come in the form of an image-based question. If you will have a GCT or an ABC, that will usually be coming in the form of a image-based question. But osteoid osteoma will come in the form of a clinical case scenario. even Ewing sarcoma will be coming as a clinical case scenario. And the sixth one that we discussed, osteochondroma, will usually come in the form of an X-ray. So after 6 updates, the 7th update which I want you to understand is one-liner. Most common bone tumor, I hope you guessed it, wrong. It is not multiple myeloma, it is not osteosarcoma, it is metastasis. One more try. Most common malignant bone tumor, yes, you guessed it wrong again. It is not multiple myeloma, it is not osteosarcoma, it is metastasis. So most common bone tumor, metastasis. Most common malignant bone tumor, metastasis. Most common primary malignant bone tumor, yes, multiple myeloma followed by osteosarcoma. Most common bone tumor of hand bones, enchondroma. Most common benign bone tumor of hand bones, enchondroma. Most common malignant bone tumor of hand bones, chondrosarcoma. Most common malignant tumor of hand, not enchondroma, not chondrosarcoma. Did I mention the word bone? I said most common malignant tumor of hand, squamous cell carcinoma. So these one-liners were my 7th update. Time for 8th update. 8th update, you should know that there is a score which can help you in assessing that whether a bone tumor will complicate into pathological fracture or not. Can you tell me the name of the score? Merrill score. What are the 4 parameters for Merrill score? You have to calculate size of the tumor. You have to see the nature of the tumor. You have to see the site of the tumor, and you have to see the pain due to tumor. So these are the 4 parameters. The 9th update, the last update, is about fibrous dysplasia. 2 MCQs. McCune-Albright syndrome, Mazza-Brod syndrome. So if you have precocious puberty with polyostotic fibrous dysplasia, McCune-Albright, along with Kefauver spots. But if you have intramuscular myxomas with fibrous dysplasia, we are talking about Mazza-Brod syndrome. So these are the 9 important updates which I wanted to discuss with all of you today on day 2 of 9 days, 9 updates. So please revise oncology. Just spend these 7 minutes with me, and I hope in these last 7 minutes you must have understood that what kind of revision tumors want. Day 3, tomorrow I'll be coming up with 9 more updates, and that will be on the basis of a chapter called soft tissue diseases and sports injury. Thank you. All the best. God bless. Bye-bye.